In this video, we invite you to explore the details and features of body interact scenarios. Let's begin with the filters. The available filters will help you select the exact type of scenarios you're looking for, based on your institution's license. The Save Scenarios filter allows you to create a list of the most frequently used scenarios. If you save a scenario in Body Interact, it will also appear in the Save Scenarios in BEI Studio and vice versa. Now let's look into a scenario. Once you enter the case details, you'll be able to review patient data, the context of the case, and choose the duration of the simulation. When you're ready, click Solve Case to begin. Next, a written and read briefing about the patient will be provided. Get ready! Your patient is about to arrive. Now that you are in the emergency room, it's time to put your clinical reasoning to the test. Assess the situation and manage your patient with care and expertise. You will find a wide range of actions available to perform. These actions fall into 3 categories. First, priority actions. These are essential for diagnosing and treating the patient, and they will attribute points to your final score. Second, priority actions. These actions are complementary but not essential. They do not add or subtract points from your score. Non-priority actions. These actions are unnecessary or harmful to the patient and will result in penalties to your score. To assess your patient, you can conduct an interview and perform a physical examination. Position the patient either lying down or sitting. Move closer to different body areas to identify any bruises, hematomas, or other relevant findings. You can select the vital signs you wish to monitor and request any necessary tests as part of your assessment. You can review your patient information under Health Records along with your performance status. This data provides guidance on the number of first priority actions completed so far. Keep in mind that Body Interact is fully dynamic, so your decisions will impact the patient's status and evolution. So let's move into the treatment options. You may request the support of different specialists, whose feedback will depend on the patient status and health conditions. You may decide to perform specific interventions to manage your patient or administer medications as needed. As you can see, you can navigate up and down the menus or simply type in whatever you're looking for. Remember, for certain routes of medication administration, it's essential to first place the appropriate catheter or tube. The case will conclude successfully once the main health conditions affecting the patient are managed. However, if you fail to treat the patient, perform harmful interventions, or administer insufficient or incorrect medication, the simulation will end unsuccessfully. Lastly, a third type of message will appear if you choose to end the case at any given time. With the case now concluded, it's time to answer the related multiple choice question and provide a summary of the clinical scenario using a structured handoff pattern. Next, you'll access the feedback area, which includes the following topics: timeline, review the entire decision-making process, and the patient's evolution up to the case's conclusion. You can filter actions based on priority levels. Scores, review both global and partial scores, along with the priority levels of actions performed in each area. Competencies, explore the clinical competencies demonstrated during the case resolution. When performed by students, these will be added to the logbook of competencies, which can be accessed through the student's metrics in BEI Studio. Take-home message. This includes the final message of the simulation, along with the key learning goals of the case. Are you ready for your next patient? See you in the next video.